Welcome back. Well, Gujarat is grappling with a deadly Chandipura virus outbreak, with 27 children reported dead in just 5 weeks. The state has recorded 39 confirmed cases, but experts are still struggling to determine how the virus is spreading. More than 1,000 samples of sandflies, mosquitoes and ticks have reportedly been tested, yet no infected vector has been identified. Even testing of cattle has not revealed a clear animal host. The virus can cause acute encephalitis syndrome, with children particularly vulnerable. High fever, vomiting, severe headache, drowsiness and seizures can rapidly progress to loss of consciousness and death. With the transmission chain still unclear, authorities face a race against time to find the source. Gujarat has recorded 238 suspected Chandipura virus cases and 41 laboratory confirmed infections between June 30th and August 12th. According to the Health Department's latest status report, of the 41 confirmed patients, 27 have died. Jatin, my colleague, joins us on the broadcast to give us more details about this. Jatin, अगर आप मेरी आवाज़ सुन पा रहे हैं?
जी।
जतिन, क्या कह रहा है प्रशासन? किस वजह से इस इन्फेक्शन को, इस महामारी को काबू में नहीं लाया जा रहा है?
जी देखिए, बिल्कुल आपको बता दूं कि काफी गंभीर ये मामला है कि गुजरात में चांदीपुरा वायरस का कहर जो लगातार बढ़ता जा रहा है। बात करें तो पिछले 5 हफ्तों के अंदर ही 25 जितने बच्चों की मौत होती है, 39 संक्रमण के मामले जो है अभी तक जो है वो सामने आ चुके हैं। प्रशासन इसके पीछे जो है वो मेहनत जो है वो कर रहा है। प्रशासन इसके पीछे सारी तैयारियां जो है वो कर रहा है। किस तरह जो जहाँ पर भी ये वायरस के ज्यादातर जो केसेस सामने आ रहे हैं, तो वहाँ पर जो नमी वाले जो जिस जगह है वहाँ पर सभी आरोग्य कर्मियों को जो है वो जांच करने के लिए जो है वो उन्होंने आदेश दे दिए हैं। सभी जगहों पर जांच जो है वो हो रही है। हालांकि जो 39 मामले अभी फिलहाल जो 39 केस है, उसमें अभी तक फिलहाल कोई जो है वो इसमें कोई गंभीर इसमें कोई है नहीं, अभी कोई आईसीयू में नहीं है। सारे जो जितने भी बच्चे हैं सभी लोगों की स्थिति जो है वो बिल्कुल पूरी तरह से जो है वो सामान्य है। लेकिन इस तरह से इसको रोका जाए उसके लिए पूरी कोशिश जो है वो की जा रही है। हालांकि अगर बात करें तो नेशनल ज्वाइंट आउटब्रेक रिसर्च टीम है, वो भी यहाँ पर आई हुई है। उनके द्वारा भी जो है वो जांच की जा रही है। साथ ही साथ आईसीएमआर की जो टीम है वो भी यहाँ पर इसके पीछे जो है वो लगी हुई है कि किस तरह से ये जो महामारी तरह का जो रोग है इसको किस तरह से जो रोका जाए। और खास करके ये जो केस है ये ज्यादातर 5 साल की उम्र से 5 साल से कम उम्र के बच्चों में ये जो
चलिए, इस जानकारी के लिए जतिन आपका शुक्रिया। सम ब्रेकिंग न्यूज कमिंग इन नाउ। Well, Gujarat Health Minister has given a statement saying that the Chandipura virus was detected in one place. He also ensured that no new virus case has been detected and special arrangement in all Chandipura hospitals have been made. Let me also get some expert opinion on what's happening in Gujarat. Dr. PSV Rao, senior doctor, is with us. Padma Shri Dr. Sanjeev Bagai, chairman of Nephron Clinic, is also joining us on the broadcast. Dr. Salil Garg, cardiologist, also joins us on the program. Dr. Bagai, so I'll begin with you. So what are your impressions of this virus? In fact, to a lot of us, rather most of us, and even our audience watching at home, this is something new.
Good evening to everyone. I think this is a rare virus. It's not something which we commonly see pan-India. This is nowhere close to even an epidemic, so to say, forget a pandemic. These are local outbreaks. It's primarily because of the monsoons and the relative high humidity. There's an acute proliferation of sandflies, which is the primary vector, and of course mosquitoes being our evergreen partner as the secondary vector along with ticks. This is a neurotoxic virus. It has a short incubation period and it infects especially children under the age group of 5 or 6 via the CSF, inflammation of the brain, inflammation of the meninges, which is the covering of the brain, and they can go into what we call as acute encephalitis syndrome. That is unconsciousness, loss of sensorium, seizures, convulsions, and you can even have a brain infarction. That means part of your brain function because of hypoxia can be permanently lost. Like I said, the incubation period is short, high-grade fever, headache, unconsciousness, multi-organ failure. occasionally with vomiting, loose motions, and some rashes. The fatality is very high, 75%. And to be honest with you, barring a handful of few cases, I have never seen personally in my own clinical practice this kind of viral infection. So I think we need to be on guard. It's more of public awareness. It's more of personal hygiene, community hygiene, prevent waterlogging, prevent the breeding of mosquitoes. And sandflies, very uniquely, they breed inside the walls of mud. So I think that needs to be driven home, especially in the rural area, where instead of mud covering of the walls, they can use some other material. Over to you.
All right, Dr. Rao, your impressions of this virus. This is obviously has resulted in the deaths of 27 children. Could that have been protected? Could that have been prevented?
Like Dr. Bagai said just now, it's a very rare virus. It's not something that many of us have seen or experienced in other parts of India. And this seems to be always, the outbreak seems to be limited to parts of Maharashtra and Gujarat during rainy season. So it is obvious that these sandflies and mosquitoes which spread this virus are basically carrying this virus in that part of the geography of India. Now, this virus spread is by these sandflies and mosquitoes and sometimes ticks. It is not from human being to human being. It is always from some other source to humans. And studies till now haven't clearly indicated if any particular cattle or an animal is an alternate host to this. It seems to be basically in these insects and spreading from sandflies to humans. Now, as to how we can prevent it, yes, these deaths could have been prevented if beforehand certain measures had been taken to reduce the proliferation of mosquitoes and flies during the monsoon season. That's when they proliferate. So stagnant water, this is standard hygiene procedures even for various other mosquito-borne infections, that you don't have stagnant water around. You prevent the sandflies, like has already been mentioned, tend to multiply in cracks in mud walls. And hence these either you use different materials or fill up the cracks so that they don't have these crevices to multiply in, and also reduce the amount of vegetation like bushes and other things immediately around the homes, so that these insects don't breed there. And all stagnant water has to be eliminated, and insecticide spray is also used, which persists on the walls of these huts and houses where mosquitoes and sandflies sit. So cleanliness, general hygiene is important for to prevent various infections. So it is important here also, both personal hygiene and the environmental hygiene. And in case there are cattle sheds and other animal around the location of the house, the hygiene of those areas is also important. And so it is general, and awareness has to be created. What we can do is to create awareness among the people in those areas, that please keep your house clean, keep your environment clean, and avoid breeding of mosquitoes and sandflies in that area. And there are sandfly traps available which use pheromones which attract these insects. So these kind of traps can also be used in those areas. Yes, Vineet.
Dr. Garg, your impressions of how to prevent more children from suffering from this rare virus?
Vineet, both Dr. Bagai and Dr. Rao have given a very succinct explanation of the entire thing. Now, the problem today is that this is a disease, this is a virus which is, like Dr. Bagai said, endemic. It is not even an epidemic. It's something like this, that it's there in isolated corners, in isolated places. In an entire village, there might be just one case. In a few multiple villages, in a large number of villages, there might be just a few more cases. So patients do come to the hospital with features of encephalitis. and the treatment is mainly supportive. They have to be treated for encephalitis. Most of it is supportive treatment. 75% of the there's a 75% mortality. So I do not think that, except for taking better measures for hygiene, which I think we should actually be taking as a nation, and which, in spite of the Swachh Bharat program, we have not been able to absolutely go ahead and take it to every village or to every place. We have really not risen very high in that, but I think that is something which has to be given importance, especially and in such areas where there are sand flies and all. It is very important that sand fly menace is taken care of.
All right, some breaking news coming in now. Well, Gujarat is witnessing a fresh and deadly Chandipura virus outbreak, with 25 children reported dead in just 5 weeks. Health authorities have confirmed 39 cases across 12 Gujarat districts and 3 districts of Rajasthan. The biggest concern: despite testing more than 1,000 samples of sandflies, mosquitoes and ticks, investigators have not identified any carrier. Cattle samples have also failed to reveal a possible animal host. Cases are spread across districts without a clear geographic cluster, making the source of transmission difficult to trace. Chandipura can trigger acute Encephalitis syndrome, particularly in children under 15. Dr. Bagai, we also need to understand how is the Gujarat government likely to prevent this virus from spreading? It's already gone to Rajasthan.
You know, it's in a boardroom discussion or in the government offices, it's easy to make a policy, but to catch a virus and a viral infection, which is extremely rare, that too spreading from sandflies, which are breeding within the walls of some houses, it's finding a needle in a haystack. It's going to be extremely difficult. I think instead of focusing on finding the virus itself, what will be more important is to put all focus and energies, full concentrated efforts in maintaining the civic hygiene, the community hygiene, prevent waterlogging, prevent open halos where the mosquitoes can also breed, personal hygiene to prevent tick infections, and of course educate the rural part of India against the hazards of having mud walls. So I think it's a tough task. It's very difficult to find the virus. We can continue to do PCRs. The PCR also has a limited efficacy as far as this is concerned, primarily because we've hardly seen in our own clinical practice this kind of infection.
Dr. Rao, your assessment on how this can be prevented from being disseminated to other parts of the country?
In all those areas and in the neighboring areas, we will have to have insecticide spraying going on. All houses and surroundings inspected to see if there are cracks and these things can be filled in stagnant water. And also we can the government can distribute mosquito nets and other screens to protect these people from not only sandfly and mosquito bites but from insect bites in general. And repellents can be distributed. We don't have medicine for this or vaccine for this, but definitely people can be used, encouraged to use repellents, especially DEET, DEET. This is, I've written about this also earlier on in connection with other viruses. These repellents can be used to keep it. Plus, they can also be encouraged to use full clothing so that there is less exposed skin to these insects. Usually, in rainy season and summer season, people will be wearing less. We will be exposing a lot of the skin due to the heat. But they will have to be encouraged to cover as much of the skin as possible, and whatever is uncovered, let them use insecticide, not insecticide, the insect repellent creams, and also to use mosquito nets so that mosquitoes and sandflies don't. And like I mentioned earlier, there are sandfly traps available which can trap these insects. So those things can also be used. These are the things we should encourage. It will not only help control this virus, it will control other infections also. And they should be covering all the neighboring areas so that it doesn't spread out of this area and contain it to those areas. Yes, Vinit.
All right, some more breaking news coming in. Well, Chandipura virus cases have emerged in Gujarat's Saurashtra region during the monsoon outbreak. This has puzzled health experts because sandflies, the primary vector, are less common there. A national joint outbreak response team is investigating these sporadic cases across multiple districts. Cases have also been reported in 3 Rajasthan districts so far as well. Jatin, my colleague, is also going to be joining us momentarily, but let me bring in Dr. Garg into this conversation as well. Dr. Garg, well, I know it's still an evolving situation, but the fact of the matter is that most of us have bad memories of a recent pandemic which plagued the world. And obviously, every time something like this comes up, there is a scare of it being spread. Is the Indian government going to go by the mantra, once bitten, twice shy?
That's a very, very interesting question. And if you look at it, the Chandipura virus was first isolated in 1965. Ever since, they have been very, very sporadic. I would say very, very sporadic, because maybe it requires a double adjective. Uh, Very rarely do we get across these cases. As Dr. Bagai has said, he's hardly seen any, and being a pediatrician, if he's not seen many, one can realize how rare it is. Now, the most important aspect is that we have to go to the bottom of the problem. The problem is very simple. If we have got good hygiene, we will be able to take care of all this, like through mosquitoes or through the sandflies. The second part is the ability to identify and treat these diseases or these encephalitis, this kind of disease when it presents to us. A child coming with fever, seizures, altered sensorium is the child that we evaluate completely, and the entire aim is, if we can provide adequate supportive care, we should be able to do that. The third point is whether the government will be able to deal with it. I think so, because in this case, the cases are few and far between and isolated. There's no known transmission from man to man, and at present, we are not even very sure as to what the vector is. The sandfly is there, but as you yourself said, repeated tests on various kinds of vectors have not yielded any results. So that is why in this case, I think we should not be too worried, and unless it really spreads voraciously, and we get to see a lot more cases. Otherwise, I think this would be more of an isolated problem which can be dealt with once the health authorities are more aware of the problem.
Dr. Bagai, same question to you as well, sir. What are some of the learnings from COVID that can be implied as well as applied here?
Oh gosh, that's a
loaded question.
Known one. That's a known one and a tough one, because COVID has taught us so much. I think ultimately COVID has taught us that if we are complacent, we'll be caught napping. It's taught us the ABCDs of personal hygiene. It's taught us everything of hand hygiene, of keeping personal distancing, what we call as social distancing. Unfortunately, this particular Chandipura virus has no known vaccine and no known antidote as far as antiviral is concerned. So all we can do is to give supportive care, and in case any child unfortunately has neurological symptoms, then is to intervene as far as that is concerned, either be anti-seizure medicines or decongestant medicines for the intracranial pressure and so on. But there is no known medication for it otherwise. But I think COVID has taught us that we can't take anything for granted. And I think it's high time that we, even in the metros, look after our local community. The onus of responsibility to keep the society clean is on each and every individual. The government can only do as much for 1.5 billion people. If we are going to litter the road, if we are going to throw garbage, if we are going to allow water to stagnate, then it's a Waterloo for us.
All right. Dr. Rao, what about a cure? What about a vaccine for this kind of a virus?
Vinay, there are millions of deadly viruses in the nature, and you can't be developing vaccines and I mean, where is the money to develop all these things, cures and vaccines for every virus prevalent in the world? The best way is to prevent. Prevention is always better than cure. And in a deadly, not only this, we have had discussions on hantavirus, Ebola virus, and so many other deadly viruses around. So the best way is prevention. Why is the rest of the world not getting any of these particular viruses? Why is it not spreading like COVID-19? It is because COVID-19 was an airborne infection. This is an insect-borne infection. So if we can control the insect population, take measures to prevent it, then it can. And to your previous question to other panelists about what did we learn from COVID, as far as I am concerned, the two most important things we learned from COVID is one, to get the information across, to educate the people about what they can do to prevent getting infected. This is a very important thing. The other important thing we learned was the importance of infrastructure. If people are in places where they can't be reached, where medical treatment can't be reached, yes, we have only symptomatic treatment for this, but that can also save lives. But if there is no road to reach those places, the places are flooded, or there is no electricity there, there is no water, drinking water there, then you have a problem on your hands. So those things are also important. These are two major things we learned during COVID: the need for infrastructure and the need to inform people as to what they can do to prevent having problems, getting such infections, insect-borne infections. Yes, Vinit.
All right, fair enough. Well, appreciate all of you joining us, Dr. Bagai, Dr. Garg, Dr. Rao. Thank you so much for those insights. I'm sure they will come handy to authorities in Gujarat. We'll take a short break. Be right back.